Effects of Nisstex on benign prostatic hyperplasia, or commonly known as BPH. Benign prostatic hyperplasia is the most prevalent age-related disease of the prostate gland for men. Okay, BPH is a non-malignant growth of the epithelial and stromal cells of the prostate gland. Non-malignant means it is not cancerous, it is just a normal growth, and it has no metastatic effect. It doesn't form or spread to other organs as other cancer, and this is not a cancer actually. Benign prostatic hyperplasia is really usually not a very serious disease when it is expressed in a very mild form. Okay, initially it can happen to many people, but the condition is not disturbing. It is not really problematic. But if the condition persists, if the situation becomes worse, then the problem is more significant and the patient will feel uncomfortable and will have a lot of complaints regarding the BPH. The symptoms which appears includes urinary tract obstruction. It's difficult to urinate, frequent urination, the urine retention is low. That means you urinate more frequently, and sometimes the urine is retained in the bladder for a long time, and it cannot flow out. And decreased diameter of the urinary tube. That means the diameter of the urinary tube becomes smaller because the prostate gland compress on it. Okay, the urine cannot flow very well because it is almost like blocking, because the tube becomes very much smaller and dribbling at the end of urination. BPH is characterized by prostate gland enlargement, which is due to the hyperproliferation of the cellular components. That means the cellular components multiply faster and grow bigger and bigger, and this enlargement compresses on the urethra. Okay, this is the urinary tubing, that that the place where the urine flow out. So this is the urethra that is being compressed because the tissue surrounding it becomes bigger, so they press on the urethra and the urethra becomes very small. The most common drug treatments for BPH include the use of alpha-adrenergic antagonists and 5-alpha reductase inhibitors, and there are also many other alternative therapies. Some uses natural products and so on. This is how the normal prostate looks like, and the prostate with a benign prostatic hyperplasia looks like. If you look at the normal prostate, the urethra is big and urine can flow very well. But if you look at the BPH prostate, the urethra becomes narrow because the enlarged prostate compresses on it. Recent studies have shown that there is a very good relationship between oxidative stress and benign prostatic hyperplasia. So now people are using the oxidative stress to measure the extent of the BPH. Usually BPH in the clinics, they are treated with a drug called finasteride. Finasteride is in the class of medication called 5-alpha reductase inhibitors. That means it inhibits the enzyme which we call the reductase inhibitors, and this enzyme, alpha reductase, is an essential enzyme that converts testosterone to dihydrotestosterone. So finasteride inhibits this conversion. Okay, and finasteride treats BPH by blocking the body production of testosterone that causes the prostate to enlarge. The more testosterone you have, the more enlargement it becomes. So finasteride inhibits the synthesis of testosterone to dihydrotestosterone and the prostate will be growing less much rapidly. The role of Nisstex in addressing benign prostatic hyperplasia. Nisstex contains Nigella sativa, monk fruits, and some vitamins and minerals. These are all important components which can help in addressing benign prostatic hyperplasia, and it has been reported that BPH can be rectified or can be improved by consumption of Nigella sativa or Nisstex after a few weeks of daily consumption. This is because the seeds of the sativa, Nigella sativa, are very rich in fixed oil, which is renowned for high level of unsaturated fatty acids such as oleic acid, linoleic acid, and linolenic acid, and this is partly the cause of the effectiveness of the Nigella sativa. And previous studies have further reported that these fatty acids can prevent the growth or the proliferation of the prostate cells that is induced by testosterone and dihydrotestosterone. So additionally, it has a capability of inhibiting the 5-alpha reductase, an enzyme that can block the production of testosterone to dihydrotestosterone. Okay, and Nigella sativa has further been demonstrated to exert an antioxidant and anti-inflammatory property as well. So this make it much more useful, and it has many prongs to attack the prostate problem. And one finding reported in Biomedicine 2021 says that, interestingly, it was found that Nigella sativa oil partially or at least decreased the dihydrotestosterone level in the BPH model more than that of the finasteride. It simply means that it looks like that sativa, Nigella sativa component can do the job much better than finasteride. So it is much more effective than finasteride, and the good thing about this Nigella sativa is that it does not show any side effect. So the patient are very safe when they use Nigella sativa or sativa plus. This is the paper that was that is reporting the role of Nisstex in addressing benign prostatic hyperplasia. Nisstex can be consumed 2 tablets a day, two tablets 2 times a day, and it can be after or before meal, and this is used for the first 1 week as a loading dose, and subsequently after week 1 you can have 2 tablets a day for good compliance throughout your treatment. And this is very important. Compliance is very important, because if we miss 1 or 2 dose, this will not be very good for the treatment, as Nigella sativa is food. They are not stored in the blood for a long time.